Hello everyone, welcome to our show Between Friends, Conversation with Maitri. In today's episode, I am your host Nandini Ray and we will be discussing the importance of child abuse prevention, and we are hoping to engage our listeners in raising awareness about this issue. As a nation, we must do everything within our power to stop child abuse and neglect before they occur. To discuss this very important issue, we have invited Dr. Suzanne Frank and Steve Barone. Both Susan and Steve have extensive experience and knowledge in child abuse prevention field, and I'm glad that they are here today to share their experience, knowledge, resources, and strategies to prevent child abuse and neglect. Friends, let me give you a small introduction about Susan and Steve. Both of them are experts in their own fields. Dr. Suzanne Frank is a supervising pediatrician at school health clinics of Santa Clara County. She retired last year after working at Kaiser San Jose for almost 30 years. She was the Child Abuse Services and Prevention Champion and ADHD co-champion. Susan received her medical degree from the Northwestern University. She has worked at the Santa Clara County Children's Shelter and Juvenile Hall. Subsequently, she continued to work as a pediatric SART examiner in Santa Clara County for 20 years. Susan received the Santa Clara County Child Protector of the Year Award in 2018 from the Child Abuse Prevention Council, a Board of Supervisors Commission. Steve Barone is the retired director of Family Court Services in Santa Clara County, former adjunct faculty for the National Council of Juvenile and Family Court Judges on the subject of juvenile dependency mediation, and for Santa Clara University, where he taught in the graduate department of counseling, psychology, and education on subjects including child abuse and neglect, domestic violence, elder abuse, substance abuse, and trauma. Steve is also retired from 25 years of private practice as a therapist. He continues to serve as an occasional trainer for the court system, as well as various community agencies on the impact of trauma on child development and victims of domestic violence and trauma-informed systems. He has been the recipient of several awards for services to children and families from Legal Advocates for Children and Youth, the Judge Len Edwards Champion of Peace Award from the Santa Clara County Domestic Violence Council, and for the training of mental health professionals from the Santa Clara County Psychological Association. He currently serves on the board of the Domestic Violence Intervention Collaborative, the Santa Clara County's Child Abuse Prevention Council, the Greater Bay Area Child Abuse Prevention Council Coalition, the Santa Clara County Domestic Violence Death Review Team, and occasionally on the Santa Clara County Child Death Review Team. Wow, I'm so excited to have you both in this show. Thank you so much for coming.
Welcome.
So, listeners, you may know that April is Child Abuse Prevention Month, and this is a great opportunity for us to talk about this issue. Let's start our discussion on what is Child Abuse Prevention Month means. I would like to, both of you, if you can talk about, can describe the importance of Child Abuse Prevention Month.
Child Abuse Prevention Month is typically the month of April across the country, where all of our local agencies try to shine a light on the issue of child abuse and neglect to keep it in the view of the community, because child abuse and neglect traditionally is not something people want to think about, because it makes you feel uncomfortable and it makes people feel helpless and anxious. And so they would rather not think about it. And it tends to happen anyway behind closed doors and in secrecy. So you have to keep the light shined on it. And what we try to do is educate the community on things that they can do that might help prevent child abuse and neglect, and support one another and the community and their neighbors and their family members in positive ways. We also typically every year do a child abuse prevention symposium for about 400 people and professionals of various agencies in the community and community members on a theme This time we had to cancel it this year for the first time because of the shelter in place. And it was going to be on the impact of gun violence on children. But we'll plan to do that sometime in the future. There are various activities that happen, including proclamations and declarations from the Board of Supervisors. But the basic point of it is to shine a light on that and keep that in front of everybody so they pay attention to it, and encourage people when they get concerned about children to report their suspected abuse and concerns to the appropriate child abuse protective agencies and or law enforcement.
Thank you. Susan, do you want to add anything?
Yes. At Kaiser, what we have done in the past to educate our patients and families about Child Abuse Prevention Month is we use the color blue, which is the color on the blue ribbons for child abuse prevention. And we made wreaths, fabric wreaths out of blue and white. We have pinwheels, and we decorate to bring their attention. And we usually have a theme each year. One year it was father-friendly Kaiser, and we put up large posters of fathers and children engaged in different activities. And we emphasized to our staff to include fathers in the medical care of children, because we found in our medical charts at Kaiser, most of the time we didn't have the father's name, his birth date, what activities he does as compared to the mother. So we tried to educate our staff. This year with COVID-19, that became the theme, and we're educating our doctors and nurse practitioners, our providers, to be aware of stress, and that we have our pediatric social workers available to help families with stress during COVID-19. And we've sent the Child Abuse Service and Prevention committees at all the Kaisers have sent out to all the doctors doing telehealth 2 questions to always ask about assessing for safety.
Since both Steve and Susan, both of you were talking about COVID and the lockdown situation, and I was reading an article that says with schools closed and teachers unable to report suspected cases of abuse and neglect, states are reporting fewer calls to child abuse hotlines. For example, calls to Washington State's child abuse hotline are down about 50%. Calls have gone down, but that doesn't mean that abuse has stopped, right? So it's possible that children suffering in silence and it is unreported. So how is the current COVID-19 lockdown situation affecting the incidence and reporting of child abuse?
Child abuse tends to thrive in environments that are isolated from outside sources of support and outside resources who can identify it and report it. So while the reports are down, including locally in Santa Clara County, about 50%, all the indications are that the actual incidence of child abuse is rising. And it's rising because of isolation, also conjoined with the kind of increased stresses that families are feeling, including parents and caretakers who are more vulnerable to perpetrating child abuse and neglect, making life harder for them, and where people are confined with one another. And so just anecdotal reports from the Bay Area resources suggest that the reports that are coming to the attention to the system appear to be somewhat more serious and more severe than they normally are, where cases may be identified at a lower level, which is a good thing, and earlier and at a less severe level. Now it might be taking more for it to come to the attention of someone, and it's much more difficult to identify because kids who are normally seen not just by schools but by medical staff and physicians and nurses and child serving agencies and extracurricular activities are not. And so they're, and sometimes from extended family. So sometimes, if we're fortunate, we get to see them on the media. and through video and through phone calls. And that becomes an avenue where we're going to have to pay more attention to this during this period of time to determine if someone is not sounding safe, looking safe, or the environment doesn't look safe, to report it. Because reports are definitely down, and all the indicators are that incidence is going up.
And here in San Jose, they've had a 50% increase with the San Jose Police Department going out for family violence calls. And in March, at our for CPS reports, they went down from 2019, where we had 120 calls in Santa Clara County, down to 50 this March. And again, without the school reports, because that's the majority of the substantiated reports. But we have to remind people all our operations protecting children continue. The Child Protective Services are virtual with telephone calls. Home visits continue. The Child Protective Services are using the same procedures as law enforcement to protect themselves from COVID-19. And the issues that are being called into CPS have taken a little bit of a different pattern. There's a lot of problems with custody. Parents are concerned, especially with joint custody, that the child is going to a house of another parent, that there's concerns that they have people living there with COVID-19. We have a lot of people calling it with COVID fears. Substance abuse, there's a lot, since everybody's at home, and as we hear reported increased sales for drugs and alcohol, so that we're getting reports of that. Also, we're getting calls in at Kaiser, parents calling in with concerns of danger, and again, that they're able to get conferenced into domestic violence support. And again, like we said, the factors that are increasing the risk of child abuse, most abusers are within the family, so now they have complete access. And online predators have more access to children online. Nationally, the increased cybercrime tip line reports, they've increased. And more we call polyvictimization, where a child is the victim of more than one type of child abuse. And one thing we're trying to teach the instructors, because the teachers are teaching virtually now, is that in the background, if a parent yells more than 2 times, that is a clue that there is stress, and that's an opportunity for us to address stress and give the parent resources to reduce their level of stress. We see that as increased risk for child abuse. Also, grooming. We want another adult to be on all messages from the teacher, and we want to require the teachers to record the virtual sessions, and also remind the teachers that conducting the session in an appropriate location, not the instructor's bedroom. Another issue that comes up is education. They're getting a lot of homework. And I was just talking with Carmen Castillo, our pediatric CAST social worker over at Kaiser Santa Clara. Just in their family, she can see the kids get a lot of work. The expectations have increased because the teachers don't have the familiarity with doing this kind of teaching. So that, when the parent sees the child being stressed by too much work, they need to respectfully talk to the teacher about this level. And also the parents, we don't want them to have unrealistic expectations of education. We want to remind them that learning happens all the time.
I'm glad that you shared what is the work has been done. Our people are working to make our children safe, and wonderful of you, Susan, to share those statistics. So since we are talking about child abuse, neglect, so I was just thinking that when a child is abused or neglected, the trauma can be a lifelong trauma, and the short-term and long-term effects can be devastating. So can you please discuss that? How does child abuse affect children over their lifespan from a medical perspective?
Right. So we call that ACEs now, Adverse Childhood Experiences. And studies were done in Kaiser San Diego back in the late 90s. And based on that work, we continue to expand research, both clinically and medically. And so the adverse childhood experiences are traditionally divided into 10 types of negative experiences, although now we're going to be calling COVID epidemic a new ACE. And so these adverse childhood experiences are traditionally abuse, like sexual abuse, physical abuse, psychological abuse, or neglect, physical or psychological, and also household dysfunction. So in the house someone grew up in, was there domestic violence, mental health problems, incarceration, separation, or divorce? So we can look at these exposures that people have during their childhood, and we know most people have them. Over 2/3 of people have at least one adverse child experience, and over 25% have more than 4. And these adverse child experiences stress the body, stress the brain, and the brain affects the rest of the body, affects the immune system, affects the endocrine system. So we know with these experiencing this toxic stress, it affects the immune system. So in this time of COVID-19, we know people are not going to fight the infection or the sequelae or the negative effects of the virus if they're under stress. So we'll talk later about stress reducing activities, but all of these adverse experiences affect the body, and both physically and mentally. And if you have more than 6 adverse childhood experiences, that decreases your life expectancy by 19 years. But also all these adverse childhood experiences, the stress takes a toll on the body with increased rates of diabetes, increased rates of heart disease, increased rates, difficult to control asthma. Almost every medical problem is affected by stress. Now, the good news is that we can recover. We can build resilience in the body. So it's not, your past is not your destiny. And that is why we want to prevent the toxic effects of the ACEs epidemic on the body. It's sort of like what we call the second wave of illness and death and violence and mental health problems. So it's not just the COVID-19, actually the germ causing infections, but it's all the environment that we are experiencing because of the increased anxiety, which is going to be leading to depression. And we try to tell people when we're looking at people, we want to think of not say what's wrong with that person, but what happened to that person. And we know it's multi-generational. How we were raised is affecting us, and that affects how we parent our children.
So what I'm hearing, that it is possible that one child who is seeing violence and abuse on a daily basis at their own home, they can learn, they may think that it is normal. It is normal in relationship to abuse someone, right? This is also a good, an effect on them, on their brain.
Absolutely correct. So this highlights a couple of really important things. If a child is the victim of abuse or neglect or other forms of serious trauma, it's extremely important to identify that issue as early as possible in that child's development so that that cycle can be interrupted and interventions can be provided to make it safer for that child and get that child the help that child and that family needs in order to reduce the negative effects and handle the underlying problems that are contributing to the abuse and neglect. So you need early identification and early effective intervention and services. Because if you don't, that's right. So if I'm a child and I'm being abused and neglected, and that's the only behavior that I am exposed to, that is how I'm going to learn how to treat other people and take care of myself. And it's also important to understand that, as Suzanne mentioned, child abuse and neglect usually doesn't happen in isolation. It happens in conjunction with other forms of trauma and adverse childhood experiences, like substance abuse, like exposure to domestic violence, like mental illness, depression, or severe anxiety in the home, like people who are having problems with the law. So multiple traumas are happening with regard to that, and they're exposed to these various kinds of behaviors. So one of the most important things is to do whatever we can do to make sure there's at least one healthy, supportive relationship that child has access to, that has who can provide another form, in a healthier form of role modeling for how to treat other people and how to take good care of yourselves, so they can learn the various skills that they're going to need in order to mitigate the effects of the abuse and neglect that they've experienced. So so you can take two children who have the same degree of abuse and neglect in their life. Why does someone grow up to have significant areas of emotional problems, behavior problems, social problems, work-related problems, and medical problems? And Suzanne might want to talk a little bit more about those medical problems. And another child has far fewer of those problems and does better. Often, and sometimes it's pre-genetic disposition, but often it's because that other person had other resilience characteristics in their environment, including the most important thing, being healthy, supportive relationships to which they had regular access, who could provide them the emotional support and the attention and the understanding and the teaching of appropriate ways to behave, and how to take care of themselves so they can mitigate the impact of the abuse and neglect.
Oh, thank you. Thank you so much, Steve, for sharing your insight. Friends, for those who have joined us late, we have two experts from the child abuse prevention field, Dr. Suzanne Frank and Steve Barone. And so far, we have discussed the serious lifelong trauma children suffer from abuse and the impact of COVID lockdown on child abuse reporting. This is the time for us to take a short break. Don't go anywhere. We will be back soon.
अगर आप या कोई और जिसे आप जानते हैं जो घरेलू और डोमेस्टिक वायलेंस से गुजर रहे हैं, कृपया मैत्री से संपर्क करें। मैत्री की सेवाएं बिल्कुल मुफ्त और विश्वसनीय हैं। हमारी सेवाएं हिंदी, पंजाबी, मराठी, गुजराती और अन्य दक्षिण एशियाई भाषाओं में उपलब्ध हैं। You can call us Monday to Friday 9 to 3 p.m. on 188-862-4874. For after hours, leave voicemail in your language. You can also email us at maitri, maitri@maitri.org.
Friends, I'm your host Nandini Ray, and you are listening to the Maitri Show Between Friends, Conversation with Maitri. And I'm so glad that we have Steve Barone and Dr. Suzanne Frank with us to discuss a very important issue, and that is prevention of child abuse. Steve and Susan, I want to share something with you. When we talk to our clients, survivors of domestic violence, most of the time we see that the children are also, depressed, they are suffering. But many times, ordinary people in our community, they think that children are not noticing if we are arguing, if we have any non-healthy, abusive relationship. Children are not noticing. Children don't know what is going on. From medical perspective, do you think that domestic violence, is there any relation between domestic violence and child abuse? Domestic violence, can it lead to child abuse, or does it have any negative impact that can create on a child's life? Anything you want to share?
Yes, as I said before, domestic violence is considered an ACE, an adverse childhood experience. And by studies, we know that leads to increased problems of physical and mental health. And especially now with COVID-19, we're seeing increased domestic violence and increased child abuse. And we should not look at those in parallel, because most of the time, if there's domestic violence, over half the time, there's also child abuse. So when someone reports to us that they have domestic violence in their home, we are obligated to talk about child abuse and look into that also. And as far as statistics, 54% of children who have been sexually abused also have domestic violence in the home. And that's even higher if the mother was physically abused as a child. And witnessing parental violence can be physically dangerous. The children can get physically hurt, but it's also psychological abuse. And this causes significant emotional harm and risk. Again, we always look for signs of sexual abuse, physical abuse, and neglect if we see domestic violence in the home. And not only is there the risk of being physically hurt by for the children, but also the emotional abuse by the parent. And if the parent is experiencing verbal abuse, threats, and controlling behavior, that the parent is being emotionally abused, that affects the children. And even when we don't think the children hear and see, they do hear and see. And the children, the symptoms we're going to see, the common symptoms of the trauma is, we call FRAID, is a mnemonic. F for fits, frets, and fear, anxiety. R for regulation disorders like ADHD. When we see problems in regulation of attention and ADHD, we always need to look and see, are there adverse child experiences going on, so domestic violences or abuse in the house. A for attachment disorders, when there's problems between the relationship between the parent and children. Yelling and yawning, why? That would mean like tantrums and sleep problems. E, educational delays. And D, defeated. So when we see domestic violence, when we hear of domestic violence, we need to assess the children for these symptoms called FRAID. And this is a sign that there is a risk for long-term physical and mental health effects.
Mm-hmm. Steve, do you want to add anything, or Susan covered everything?
Yeah. And one major point for everybody to understand is a lot of times parents will tell one another so they don't feel as bad about it, that the kids didn't know about it. But what the research says is they almost always know about it. They might be in their bedroom with their hands over their ears, or humming to themselves, or turning on the music louder so they don't hear it, but it still affects them and it still traumatizes them. And the other thing is for people to understand, and they don't think about it this way, that exposure of children to domestic violence is always emotionally abusive. And some kids may be more resilient than others, but there's no good that comes out of it with regard to that. So it's important for them to understand and the impact of that. And the third thing is that sometimes people say, well, the kids were very young, they really aren't going to remember it, and it's not going to affect them. It's exactly the opposite. The younger children are, when they're exposed to domestic violence, the more it can impact their brain development, because trauma and the toxic stress that goes along with it can interfere with healthy brain development. And I'm going to suggest to your listeners, if they want to see something on YouTube that will give them a real good explanation of how and why exposure to domestic violence impacts kids and is emotionally abusive to them, and it can lead to long-term impact, is to watch a YouTube video called First Impressions, Exposure to Violence and the Child's Developing Brain. I'll say that again. First Impressions, Exposure to Violence and a Child's Developing Brain. It's 14 minutes long. It's a great one. And Suzanne is citing research which is important to understand. When there is significant domestic violence, at least half of the time there's also child abuse beyond the normal emotional abuse that occurs by exposure to domestic violence. And when you find serious child abuse, at least half the time there's also domestic violence that's occurring in that family. So for the child, they're accumulating various forms and numerous forms of trauma. And again, with regard, you may have a parent experiencing post-traumatic stress disorder because of their victimization by the domestic violence, depression, anxiety, and often substance abuses in the home. So when you get one serious problem in one area, usually it's not limited to that one. There are multiple problems. And as Suzanne described with the ACEs, it's the number of those things and the accumulation of trauma that puts a child at risk of increased potential for experiencing very, very long-term problems unless somebody intervenes, the child is made to be safer, and the child and the family get the resources they need to deal with those problems so the child can begin to recover. It's also important to understand this, and it's true for not only children, for everybody. You cannot recover from child abuse or neglect or domestic violence or any type of serious trauma until you're safe. You have to be physically safe, emotionally safe, sexually safe. And then you can begin to recover. And a kind of a metaphor for that, or an analogy, is like a boxer in a boxing ring who is injured is not going to heal that injury or that cut that boxer experiences while the fight is still going on. The bell has to ring, the fight has to stop, the trainer needs to come in, and the medical people come in and start treating that wound, and then the person can begin to heal. May have to go to some kind of rehabilitation, get some help, get some rest, and recover, but you got to be safe before you can recover from that.
Great analogy, Steve. I'm hoping that many people out there are listening our show and they are learning that DV, domestic violence, has a huge negative impact on all children if they are witnessing domestic violence. And, statistics wise, I was reading one article that says that statistics say in the United States, more than 4 children die from child abuse and neglect on a daily basis. And over 70% of these children are below the age of 3. And most of the times, perpetrators are parents or family members. That means they are under domestic violence. So if what you have so far discussed that, how to, that for a medical practitioner or a law enforcement officer, they can see that trauma and the child is suffering from abuse. But for example, if I am a neighbor and family friend, how do I know that a child is being sexually, physically, or psychologically abused or neglected? Is there any sign of abuse that I can know that that child is facing some kind of abuse?
Okay, there are physical signs. If you see bruising, if you see the children are losing weight, if you see sadness, the other thing is a change in behavior of the child, and talking with them about how school's going. If their grades are dropping. Also, we get concerned. If you see the family having violent arguments or somebody's out of control, if you have the caregiver, the parent, talking about the child in negative terms, those kinds of things would make you think, well, that you want to talk with them, offer support, but also always assessing safety.
Yeah, some kinds of general signs that people can look for that are harder now to become aware of because we're not with children as much. But the typical kinds of signs include a child who appears frightened of a caretaker, a child who has obvious injuries or bruises, and there's not an appropriate explanation that's believable or consistent with regard to explain it, either from the child or from the parent or caretaker. Children, and you're not going to be able to see this as well, but children who attach very, very quickly to strangers or new adults in their environment. For sexual abuse, children who demonstrate unusual sexual knowledge or behavior for their age. That doesn't automatically mean they've been sexually abused, but it's a red flag that it should be checked out. Difficulty walking or sitting. I will tell you this, for parents who are worried right now, to kind of interject this, that their child may have been sexually abused by somebody physically, they can contact the Center for Child Protection at the Valley Medical Center, and they will answer your call, I believe, 24 hours a day, and then make an appointment for you to bring them into that center for a physical examination by people who are professionals and the best at their trade. It's called the Center for Child Protection at Valley Medical Center. If anybody comes aware or witnesses an adult inappropriately touching a child, obviously, or watching pornography with a child, or saying sexual things to a child, is an indicator. Any child who shows extremes in behavior, overly aggressive or overly passive and compliant or withdrawn. If a child appears emotionally unattached to a parent or a caretaker, is a warning sign. If you see a parent who is constantly blaming or belittling or berating a child, refusing to help a child when needed, if there are indications that a child is begging or stealing food, has severely poor hygiene, or states that nobody at home is caring for him or her. If a child is using drugs or alcohol, is a major problem. or if you know that the family is undergoing an extreme amount of stress and there is substance abuse in the home, and anytime there are unlocked guns or weapons available to a child in the home, those are just some of the indicators. But what the child abuse professionals are telling us now in the time of coronavirus is trust your gut, trust your intuition. If something does not look safe, sound safe, or feel safe, report it. And if you suspect child abuse, and if you think it's an emergency and something is happening right now, call 911 and call your local law enforcement agency. If you just think it's not something that's happening as we speak, but something that's occurring in the home, you can report it 24 hours a day to the 24-hour reporting hotline. And that phone number is 1-833-SCC-KIDS, KIDS. I'll say that again, 1-833-SCC-KIDS.
I think every community members and concerned citizen, they should know this number, and they should be aware that help is available if they have any concern that a child is being abused or at risk of being abused, so that they can reach out to someone for help. And thank you, Steve, for sharing this information. I would like to say one more time that Santa Clara County Child Abuse and Neglect Hotline, that is 24 hours on, 1-833 SCC-KIDS, KIDS. Please call them if you suspect that any child is in any kind of danger. So Susan and Steve, if you want to share any local resources that help victims and survivors and families to heal, please feel free to share that with our community members, with our listeners.
Yes, most of the medical centers do have pediatric social workers that are a good resource. We have Carmen Castillo, who's the pediatric social worker for Kaiser Santa Clara and Milpitas, Mountain View, Campbell. And we have Elena Tang, who's a pediatric social worker at Kaiser San Jose and also covers Gilroy in Santa Clara County. And they can be reached through the switchboard at one of the Kaisers. And so we have these resources who have a lot of experience and will help people when they think there's safety problem or there's risk or the parents feel that they're stressed. We're not saying that we need to make a CPS report and that we're not meaning the child needs to be taken away. We want to be preventive. We say there's the stressful times with COVID, which means increased risk of violence, and we have ways that we can help. So we do have our pediatric social workers at school health clinics of Santa Clara County. We will see anyone. We can develop a Medi-Cal and other payment structures for anyone. If they're homeless, they don't have insurance, and we do have our behavioral therapists that can work. So contacting one of the medical facilities is helpful. Now, a big thing right now with this kids being out of school is educational resources. And we have parents helping parents, especially for kids that have autism or have ADHD, have other disabilities. By law, they should be getting a program from the school. We want to make sure that's going on. So Parents Helping Parents is there to help make sure that education continues for everyone. And they have a lot of online support groups and education for parents. Also, Khan Academy is available when parents are trying to help the kids. And then for the parents that are getting stressed, we have now an online parenting class for free, Play Nicely, the Healthy Discipline Program. And again, helping, the resources that we can give is to help the parents working, they're concerned about extracurriculars. Extracurriculars are virtual. Parents Helping Parents can help the parents figure that out. Parents Helping Parents can help parents communicate with the teacher. And we want to help the parents to, now that they're home all the time with their children and being part of their education, realizing that, again, that learning is happening all the time, letting children follow their passion. Maybe they don't want to, the children aren't ready to work on what the teacher wants to work on that day, but there's other ways of learning. Another resource we have is a National Parent Hotline, which gives emotional support and advocacy for parents at 1-855-2736. And also we have 1-800-4A-CHILD, which is 1-800-422-453. And a child can actually text. The child doesn't have, if they're not having, they can call 911. If they can't call 911, at least they can text the child abuse people to help them. We have other supports to help parents in this COVID time, to help them with their own self-care, but also with their family. The Challenge Success from Stanford University, you can go to their website. They help parents learn to have what to do at family time, having meals, games, do service. They want to organize what we call PDF to build resilience, playtime, downtime, family time.
Let me suggest to parents at home that for any resources, you can start off by calling 211 on your phone. 211. And there are resources there, including for food, shelter, clothing, domestic violence, child abuse and neglect, mental health problems, substance abuse treatment. You can call 211, or you can put into your web window the address for 211bayarea.org/Santa Clara /. I'll say that again, 211bayarea.org/Santa Clara /. Or you can just call 211 and start there. And Suzanne's going to go, I know, but I want to mention this. You can also go to the Santa Clara County Child Abuse Prevention Council website, Santa Clara County Child Abuse Prevention Council website. The first page now says April is Child Abuse Prevention Month, prevention during COVID-19, and it will have a whole page of links to various resources for you, and you can also start there.
Thank you, Susan and Steve, for providing so much information, good information that anybody can be benefited from. And I actually don't want to end this show. It's such a good show for me. I'm enjoying listening, both of you. But the time is an issue too. So I would like to request both of you, do you want to share any advice, tips, for our community members and families, that what can families and the community do to prevent child abuse? Anything you want to share? Any advice?
Yeah, I'll start. Now I'll say, one principle is we want to surround kids as much as possible with healthy relationships. Now, on the Child Abuse Prevention Council website, there's a healthy relationships link there that has a PSA, 1-minute video public service announcement on healthy relationships in English, Spanish, and Vietnamese, where the child says, what's a healthy relationship? A healthy relationship is always physically and emotionally safe, respectful, caring, and never, ever abusive or violent. And that surrounding kids with those relationships helps them to grow up to be healthy, happy, strong, kind, and productive. And if there's one thing we can do, we can try to do that as much as possible, because not only does that help prevent child abuse, but when it happens, it helps identify it early and then get the child the help they need. Being involved with children in those kinds of relationships builds children's brains and neurological systems in a way that makes them more resilient, so that if they do encounter trauma in their life, they're more likely to have a really good prognosis for recovering, bouncing back, and transforming that into something positive and constructive in their life with regard to that. Other things I will mention this, that we want to incorporate into our educational system from pre-kindergarten through high school as much social emotional training for children, including things like not only healthy relationships, but how to regulate their own emotions with breathing exercises and meditation skills and arts and creativity, learning about the components of healthy relationships, how to practice them, how to prevent bullying, how to ask for help, about how to have safe dating relationships and identifying relationships that aren't safe, teaching them no later in high school about things about what's a healthy attachment between a very young child and a parent and a caretaker. How do parents and caretakers build healthy brains? We need to teach people and prepare them before they have children about early childhood development and healthy attachment, about how important it is to provide them with good nutrition, prevent them from exposure to environmental toxins, protect them from trauma, and provide early good child education. That is long-term child abuse prevention. Also, taking excellent care of pregnant women from the time children are still in utero, because a child's brain is developing, especially in the third trimester, and whatever negatively traumatizes mom can impact child development. So we want to do that also. Those are some of the things we can do, while also educating people on the importance of supporting policies, political policies, governmental policies that support families and children. Provide them with medical care so that everybody has good medical care. Tries to get rid of poverty and address all the problems that go along with poverty to reduce the level of stresses in families so parents can be the best potential parents they can be. Those are some of the things.
Yeah, so that is the one thing, I'm like hearing the bottom line is if we want to prevent child abuse, we have to take care of children before they're born.
That's correct.
So good. Suzanne, you want to add some tips?
Yeah, also with community members and family members, don't be afraid to talk to someone. You seem to be having a really tough time. What's going on? Or how are you feeling? Because we know when adults feel better, they can connect to children better, and this will protect the children from the effects of stress and supports their healthy growth. Helping families out, supporting them. Of course, now some families need housing, some families need food, and also helping, the schools with the virtual education.
Let me just comment with that. It's very important for us during this time of shelter in place to stay connected with people, to let them know we're there, to let them know they're not alone, to let them know that if they need to talk about something, we're there. And if they ask us for help or support, if we can't do it ourselves, we will try to do everything we can to get them the health and support they need. That people are not alone, we're in this together, and we're here to support one another.
Wonderful, Steve. Wonderful, Susan. This is really, really a good show. I hope people are listening. People will listen this show, and I'm sure they will learn many things, many information from this show. Listeners, every child deserves the security of a stable, loving, and nurturing home. We must work together each day in defense of the most vulnerable among us, our children. We must make every effort to ensure that they are treated with dignity, love, respect, and have the opportunity to pursue their dreams in secure and healthy environments. Healthy and happy children are the foundation of our society, right? Healthy society.
Absolutely.
Yeah. So with this note, I'm concluding this episode, hoping that we will be able to end child abuse from our society. Keep listening to our show Between Friends, Conversation with Maitri. Find us on podcast and SoundCloud. Stay safe, stay healthy. Thank you.
Thank you.
Be safe.